Hello and welcome. Let's take a look at our top story this hour. After waves of COVID swept across the world, studies on long-term effects of the virus have started emerging. These studies point to worrying consequences such as neuropsychiatric conditions. An observational study of over 1.25 million health records of COVID patients has been published in the Lancet Psychiatry journal. It shows that the risk of developing conditions such as psychosis, dementia, and seizures is higher even after 2 years of infection. It also showed that anxiety and depression are common short-term symptoms. The increased risk of depression and anxiety in adults lasts less than 2 months. The likelihood of these symptoms were lower in children. The risk of brain fog also subsided quickly in children. However, prolonged risk of seizures and psychotic disorders were observed in children. The results have important implications for patients and health services. It suggests that neurological conditions are likely to occur for a considerable time after getting infected. The study shows the need for more research on the cause of these issues. It also highlights the need to prevent or treat these conditions. The study analyzed data on 14 neurological and psychiatric diagnoses. These were gathered from electronic health records over a 2-year period. These individuals were matched to an equal number of patients with other respiratory infections to act as a control group. Adults aged between 18 to 64 had higher risk of cognitive deficit and muscle disease even after 2 years of infection, whereas in adults over the age of 65, there were higher cases of brain fog, dementia, and psychotic disorder. These observations were made in comparison to other respiratory infections. Reports from COVID-19 patients infected during different pandemic waves were also compared. This was done to study differences in the impact of the Alpha, Delta, and Omicron variants. The Delta variant was attributed to higher 6-month risks of anxiety, cognitive deficit, and seizures. However, it posed lower risk of dementia compared to previous variants. Omicron showed similar results as Delta. Now, for more on this, we are being joined by Professor Manfred Green, who is a professor of epidemiology at the University of Haifa in Israel. Welcome to the broadcast. Now, can you take us through some of the neurological side effects of long COVID and who will be more affected, adults or children?
I think we need to start off by, thank you for inviting me, I think we need to start off by making sure that we are talking about data that are what we call observational data, so there clearly could be some biases in the data. In other words, it is possible that the people who became severely ill from COVID or may be more selected than others. For example, outbreaks in institutions, for example. So we need to know that that kind of bias has been taken into account in these kind of studies. I think the second important point to remember is that we often are talking about a relative risk. So the absolute risk might be quite small. In other words, if you say that, for example, if 1 in 10,000 people suffer from something and 2 in 10,000 suffer from the disease if they're exposed to something else, then it's double in those who are exposed, but the absolute risk may be very small. So we really need to also convert this information to what we call the absolute risk. Clearly what we see now is that it's more common in adults and elderly adults. And that, I guess, is not surprising because it's we see dementia and cognitive change and so on much clearly mainly in elderly adults. So I think that we need to take this very seriously and make sure that we are preventing COVID as much as possible, primarily through vaccines, now that we have good vaccines. And people who are at very high risk of severe disease should take extra precautions, particularly in public places where they should be wearing masks and trying to distance from people and not to be too close to large crowds.
Professor, is there a difference in the impact of long COVID when we compare between the variants, as an example, Omicron and Delta?
don't think there's evidence yet that the actual long COVID is different. It's also not entirely clear to what extent the long COVID or the effects are related to the severity of disease, but it does seem to make sense that the more severe the disease, the more likely you're going to get long-term effects. So I think that's information that's going to emerge, and these are the studies that are being carried out right now. So gradually we'll be learning whether there is a difference in the variants, but at the moment, the variant at the moment, the Omicron and so on, is not, it seems to be milder in its impact than the Delta, for example. So again, we need to learn more about this.
Absolutely, Professor. Thank you for being with us on this broadcast and your valuable insights there.
Pleasure.
WION, now available in your country. Download the app now. Get all the news on the move.